Today is one of those days that we're going to circle on our calendar and remember the part that we played in improving the quality of our life for everyone who lives in this wonderful, wonderful region that we call home. From 2007 to 2011 in North Carolina, nearly 250,000 of our neighbors were diagnosed with cancer. During that same period of time, in Craven, Jones, Pamlico, Carteret, and Onslow counties, over 9,000 of our friends and family members, perhaps one of you here today, received that troublesome diagnosis. During the 4 years between 2008 and 2012, we lost just over 89,500 North Carolinians to cancer. In the 5 counties that I previously mentioned, our home, we said goodbye to 3,500 of our loved ones and friends. 4 of the top 10 counties with the highest annual incidence rate for cancer in the entire state of North Carolina directly border Craven County. Carolina East wants to change those numbers, and with the support, the clinical expertise, and the partnership of UNC HealthCare, we really want to do just that. As we began to look closely at our cancer care in the region, we began to realize a number of things. One, we were blessed with really good physicians and other clinicians, and we wanted to expand on that. We recognized that the foundation was in place. It just needed to be enhanced and expanded. 2, we saw pretty quickly that our cancer care was terribly fragmented. We had really good care, but it wasn't as efficient as we wanted it to be and that those cancer patients deserved for it to be. The region had good cancer care, but the cancer was fragmented and there were gaps. Third, we saw that there were a lot of patients who were leaving the region for that care. And we felt that that was just a horrible burden for those cancer patients and for their loved ones. And we wanted to help eliminate that burden for those cancer patients and for their loved ones. As we began to conceptualize how we could provide unsurpassed visionary cancer care in eastern North Carolina, we recognized pretty quickly that we were going to need a partner. We wanted this center to provide the very latest in cancer care, including clinical trials, research, and the most current protocols in cancer treatment. And we wanted it to be an educational center where physicians and other clinicians could come and train and continue their education and to be a part of our healthcare community here at Carolina East. We knew that we needed a partner with an academic organization with a reputation for outstanding cancer care, a clinical leader that was respected not only across our state, but across our nation. It became pretty obvious to us pretty quickly that that organization was UNC HealthCare. I had an opportunity to meet with Dr. Roper and his staff. They had no idea why I was coming or what I wanted to discuss, but they graciously agreed to give me time, and they listened. They listened as I described to them our dream for a cancer center at Carolina East. And I told them what I wanted and what we wanted as a community to be able to bring to eastern North Carolina. As I described our dream for a cancer center in eastern North Carolina to Dr. Roper, I saw his eyes light up the same way that mine light up when I talk about this center. And I knew right then that I was in the right place talking to the right folks. And to be honest with you, after that conversation, I'm not sure I had to drive back to New Bern. I think I floated all the way back. The journey to bring our vision for a comprehensive cancer center to this region has just begun. And we have a long way to go. But I'm confident that we have the right people in place, and I'm confident that we have 2 very strong and very committed organizations working together to make this a reality. We wanted you to be here today because of who you are and what you mean to the region, and we need your support going forward. But we also wanted you to share in the celebration as we begin this journey. And I am so honored and so excited to share with you right now the first glimpse of what the future of cancer care will look like in Eastern North Carolina. How awesome is that? At this time, it's my pleasure to invite Dr. Bill Roper, CEO of UNC HealthCare, to the podium to share a few comments.
We're excited to be launching this partnership with Carolina East and with this community. We're a state institution. UNC HealthCare, UNC School of Medicine, that I'm privileged to lead, are part of the University of North Carolina. And as we have sought to partner in a variety of ways in a variety of locations, there are two principles that undergird those partnerships. The first is we only go into partnerships, we only go into communities where we are invited. And Mr. Leggett has told you that story. That's the way it happened. We're here today because he, on behalf of this institution, this community, invited us to be here. We're not trying to elbow our way into places or where we're not invited, but happily we have been here. And then the second principle that undergirds our partnerships is we seek to partner with strong partners. There's a lot of change underway in healthcare in North Carolina, in America, and a lot of things are up for grabs. We can do some things to work with some institutions, and frankly, we think it's a sensible notion that we partner with strong institutions so that the combined result is equally strong or even stronger. Happily, this institution, as you saw from 1963, has a 50-year track record of strength, and they've gone from strength to strength. Ray was just telling us some exciting news about their current year and how things are going. This is a strong institution built on a very strong medical staff, and it's just the kind of organization that draws us in to want to do more in partnership with you today. UNC HealthCare has great aspirations. We have three missions. One of them is to provide patient care to the people of North Carolina. We can't do it all, but what we do, we want to do at the very highest quality to as many people as we can. Secondly, it's our mission to educate physicians and other healthcare professionals for the future, and the medical school that I'm privileged to head is a major part of that commitment to train future health professionals. And thirdly, it's our mission to do groundbreaking research to undertake better ways of providing care to yet more people. And Dr. Earp, who's going to speak to you in a minute, is one of the leading lights in that effort as well. We have much to do. What you're hearing today is a promise for the future, but we want to be quickly on to the task of realizing that promise and making even better care in this community and the surrounding region, indeed all across North Carolina, available for the people that we will serve together. It's an honor to be with you today. Thank you.
It's great to be here. Actually, I noticed my first car, my '62 Chevy, was in the parking lot. It was 48 years ago, almost to the month, where I came to Chapel Hill from my home in Baltimore and met Reed and Alice Underhill and 65 other people who were aspiring medical students at UNC Chapel Hill in the School of Medicine. The hospital had been organized about 14 years before that, so we were pretty early on. And we've had the privilege of watching our place grow. Bill told you the tenets that we hold dear that started in the early 50s, that we are the state's hospital, that we're the state's medical school, and tell you about is UNC Lineberger Comprehensive Cancer Center, which is the state's public NCI-designated comprehensive cancer center. And that means a lot to us. It means that our job is to take the care of people who come to us directly, but also to look across the state and see what we can do as the state has grown from 5 to 6, now 10, and soon to be 12 million people. That's a lot of people, and we can't take care of all of them in Chapel Hill. In fact, until we get our new wards, which we're building now for our bone marrow transplant program, we are full. And so for us to serve and do what we need to do, we need to partner, particularly with strong partners who have a vision that they want to change the quality of care. Now, when Reed and I started in medical school, cancer was only then coming out of the shadows. And in the eastern part of the state, which my wife, who some of you know, is in the School of Public Health, has studied extensively, the word cancer was something that wasn't uttered very much. And even when you look at death rates back in the 60s and 70s, you'll find that cancer was underreported. You can tell that because you can see as cancer came out of the shadows and became something that people were not afraid of, that understood could be treated. We see the increase in cancer across our state and across the nation, and frankly across the world. What's happened in healthcare is a marvelous change in death rates from cardiovascular disease. And that's a great piece of news. The bad side of that is now cancer has become the #1 cause of death in this country and in this state. And it's so important that we do something about it. Our Comprehensive Cancer Center wants to do that at every level, partnering with the School of Public Health, School of Pharmacy. We want to change prevention. We want to change early detection. That can only be done in the communities. It can't be done in Chapel Hill. It has to be distributed. But so much has happened in a positive sense. When Reed and I started in medical school, 2 out of every 3 people would die of the diagnosis of cancer. Now it's 1 out of every 3, and that is a spectacular change due to what we can do in terms of detecting, surgery, radiation oncology, and understanding the human body and its response to cancer therapy. That's the good news. But the bad news is that if we, in Chapel Hill or in New Bern, with the great practitioners that we have here, it's fun to see Chris in the audience, one of our own trainees, that if we do everything right, everything that we know how to do, we're still going to lose 1 out of every 3 of our patients. And that's what drives me and about 300 members of the Cancer Center in Chapel Hill. And they're split somewhat evenly. Probably about 120 people that are looking at cancer at the most basic level, trying to discover the molecules that drive it and how we can treat it. We have people in the School of Pharmacy that are taking that information and turning it into drugs. We have about 80 people in the School of Public Health and across the college that are trying to understand the cost and cause and extent of cancer. But we have about 120 people that are actively taking care of patients. And that's a luxury. It really is. It's a thrilling thing for us to have been able, with the state support, to bring so many experts, young, mid-level, and senior people that are nationally known. They get to specialize in a way that very few people do. They get to understand their disease at a level that allows them to create knowledge. And that's what we want to work with you on, to bring that level of expertise to Craven County, to New Bern, to the surrounding counties. That's part of our job. And the mission that we have just fits beautifully with what Ray has told you about. Now, cancer care is done best in the light, with space, in a great atmosphere, and with great support. It's done best when all the doctors and nurses and staff are able to interact and understand the patient, the single patient, create the plan, and figure out how to take care of that person and their family and their caregivers. That's what's coming. That is what's going to happen in this beautiful building, because you will have all of those people together, and they will be able to interact for the individual. What we can provide, and will and look forward to providing, is some expertise to help. We can be a sounding board about what's the best plan. We can have folks that come down here and interact with the tumor board. And we can bring, I think, some of the most exciting things that are going on in the country. It turns out that cancer is not one disease. You all knew that. But even something called breast cancer isn't one disease. It's 5 diseases. Groundbreaking studies in Chapel Hill by my colleague Chuck Peru, Lisa Carey, Bob Milliken, and many others have absolutely distinguished the genetics of these 5 different diseases. And it blows everything apart. What we thought we knew about risk factors for breast cancer turn out to be right for some of these subtypes of breast cancer and not right for other types. What we thought we knew about how to treat people changes. So the disease of cancer is 200 diseases, and many of those can be subdivided. And in fact, every individual's cancer and their response to it are different. One of the exciting things that we're doing with our genomic capability is starting to sequence people's cancer. We have a clever name for it. We call it UNC. And for a clinical trial, which we have about 1,300 people on, we've been taking a part of their tumor, extracting the DNA and RNA. That's the book of life. It tells us normally what should be happening to people. But cancer is a disease where they get disordered. But they get disordered a little differently in everybody. And we were able to use some fantastic equipment that we put together, and some fantastic minds, and a lot of computer power to look at individual patients and figure out what's driving their cancer. Then we can start to apply individual responses. That's working. That's extending people's lives. That's extending people's lives with great quality. And that's what we want to do with you. It's not the be-all and end-all. Cancer is a pretty implacable foe. Unfortunately, it changes as time goes on under our therapies. And so it's a little bit of a race against time to continue. But we are winning that race. Kind of the next frontier that we're so excited about is understanding how to harness the person's immune system. Because as you know, almost no one dies of the cancer that was discovered, that lump in the breast, or that group of cells in the prostate or the colon cancer. What people die of is when that starts to get distributed around their body. It escapes from the capsule and goes other places, and frankly can hide from our therapies. A thing that's going to, we believe, is going to be the next great frontier is to harness the person's own immune system so that we can train it to go after these hidden cells and therefore eradicate them. That's science fiction in some ways. Would have been considered, certainly, if you go back and look at Star Trek, they would have been talking about this, but it's happening now. It's happening with investment that the state has made in our center, and it's the kind of thing that we want to be able to partner with you to bring to your communities. Some of that will be done in Chapel Hill because it's brand new and hasn't been done anywhere before. A lot of it will be done right here in your beautiful new comprehensive cancer center, where patients will get the best support, where their families will feel comfortable, where they don't have the stress of travel unless it's necessary. If it's necessary, that's a great thing. And we will continue, and we pledge to you that we will continue to drive the walls back, to understand this disease at its root cause. It's not just a scientific exercise anymore. It's not just pristine so we can publish another paper. Because of what we are able to do in understanding the human condition, in creating new chemicals, in understanding the immune system, in creating antibodies, we can do something about this disease. And we really look forward to doing it in partnership with Ray, with Chris, with all of our friends in New Bern and the surrounding area. Thank you for being here. It's just a pleasure for us to land here today and to be able to talk and meet with you. We look forward to working with you. Thank you.
I want to thank you again for being here today. I want to thank you for helping us celebrate. I have one other introduction that I want to make today. This special project deserves a very special person to be the executive director of the center, and we have just that person on board and committed here at Carolina East. Dawn Peel has enthusiastically and passionately agreed to be the executive director of our new center. Dawn is as smart and as capable and as committed and as loyal as anybody we have in this organization. Dawn received her BS in Clinical Lab Science from the University of North Carolina and her MBA from East Carolina University. She is certified by the American Society of Clinical Pathology as a clinical laboratory scientist, and she received her Lean Six Sigma Black Belt from East Carolina University. But probably most importantly, Dawn is a terrific person, and she is very passionate about this project, and she's been working very hard to make sure we put ourselves in the best situation to take care of these cancer patients. She will be a great executive director of our new center. As you might imagine, she's been very busy the last few months. She's been working hard. Things are making great progress and falling into place nicely. She is the right person at the right time.